Ever wonder why your chronic shoulder pain just doesn't seem to get better? Maybe you've taken some rest from your favorite lifts or workouts in the gym to have things calm down for a few days, only to flare back up again whenever you add those favorite lifts back into your workouts. Well, one of the main reasons that we see that people just can't seem to get over chronic shoulder pain, and that keeps personal trainers stuck in a cycle of pain and decreasing performance, is an imbalance in some of the muscles around the shoulder blade. If, if we take a look at the back of the shoulder and the back of the right shoulder in this particular case, we can see the shoulder blade here outlined in gray. And then we've got a few key muscle groups, especially these lower muscles down around the bottom part of the shoulder blade that are the lower part of the trap muscle, as well as the serratus anterior muscle that comes off of the rib cage and attached to the shoulder blade itself. For many personal trainers and for many weightlifters who typically participate in heavier lifts like overhead press, bench press, pull ups on a consistent level, they'll overdevelop certain bigger muscle groups like the upper part of the trapezius, as well as the deltoids, and even the lats or the latissimus dorsi, which are not pictured here, but come off of the front of the shoulder and run all the way down towards the lower back and through here. Because these other muscle groups have been worked and are so dominant, they end up taking over and basically kind of turning off or inhibiting or shutting down some of these other smaller muscle groups that are key in providing balance and harmony around the shoulder blade, which in turn starts to impact stress that's transferred through the actual shoulder joint itself. Because especially with any sort of overhead lifts, military press, overhead press, incline bench press, we need our shoulder blade to actually rotate and swing up and around the rib cage in order to open up and maintain space underneath the roof of the shoulder blade here so that we don't irritate and inflame structures like the rotator cuff, as well as the bursa in that area that can lead to impingement type symptoms. So, in many cases, we're able to identify this quickly with a few physical tests where we look at how well those muscles are activating in that area, see how much we're compensating with some of these other bigger muscle groups in through here. And then once we're able to establish that that is one of the main causes for your chronic shoulder pain, you're able to start getting some of those bigger muscles to relax through some key corrective exercises as well as some modifications in your current lifting form or your overall training program, and start getting you to work on activating and firing some of these smaller, more joint specific local stabilizing muscles. And within a few short weeks, people start to notice a significant improvement in terms of how well their shoulder blade's moving, reduction in irritation of some of the structures around the shoulder or up into the neck itself. And you're able to start pushing the needle forward and really addressing the root cause of this chronic shoulder pain.